Hi everyone, welcome back to Mobility Matters. Today we are starting a new series on frozen shoulder, also known as adhesive capsulitis. This episode will cover the basics, what frozen shoulder is, its stages, and why it's more common in people with diabetes. Although many shoulder diseases involve pain and loss of motion, frozen shoulder is most often caused by inflammation of the tissues surrounding the joint. The tissue that envelops the joint and holds it together is called the capsule. In a frozen shoulder, the capsule has become inflamed and scarring develops. As the capsule folds become scarred and tightened, shoulder movement becomes restricted and moving the joint becomes painful. It is believed that frozen shoulder can happen because the collagen in the shoulder capsule becomes sticky due to glucose molecules that are attached to it. And eventually the changes to the collagen begin to restrict movement. Now we'll speak about stages of frozen shoulder. First stage is the freezing stage, which is the onset of pain, which gets worse over time and shoulder movement starts to become restricted. Second stage is the frozen stage, where pain may stabilize but shoulder stiffness is at its peak and everyday tasks can become difficult. And finally, in the thawing stage, the shoulder gradually starts to loosen and range of motion improves over time. Some common symptoms include pain, limited range of motion, and a feeling of tightness or freezing in the shoulder. The discomfort is often worse at night, making it hard to sleep. Early diagnosis is important, especially for diabetic patients, since it can prevent long-term stiffness. Why diabetics need to pay special attention? Factors like prolonged high blood sugar, nerve changes, and blood vessel issues all contribute to joint stiffness in diabetics. If you have diabetes, taking early action at the first sign of stiffness or pain is crucial. Maintaining a healthy blood sugar level, regular movement, and consulting a physiotherapist early can make a big difference. That's all for today's episode on frozen shoulder, especially for those managing diabetes. In the upcoming episodes, we'll dive deeper into practical tips and strategies to help you manage frozen shoulder and regain mobility. So stay tuned, don't forget to like this video, subscribe to Mobility Matters, and hit the notification bell so you don't miss what's next. See you in the next episode.